For over 30 years, the team at Hope Store New Beginning Center, along with our clients and community partners, have been building lives without violence in Dallas and Collin counties. If you're in immediate physical danger, please call 911. If you need shelter or would like to talk to someone about receiving our other free services, please call our 24-hour hotline at 972-276-0057 in English or Spanish. At Hope Store New Beginning Center, we offer free trauma-informed services for those affected by domestic abuse, battering intervention and prevention services for those who have abused their partners in the past, and free community education services for any community group or organization. Domestic abuse is a human rights issue that affects a third of all Texans. We empower victims, perpetrators, and community members to live in safety and foster healthy relationships. Please call our 24-hour hotline for help or visit hdmbc.org to learn more about our services. And don't forget to follow us on social media. Hope Store New Beginning Center, building lives without violence.
But I just want to give everyone a reminder that CEUs are going to be available for this presentation, or this webinar rather. And since this is more of an open registration link, you weren't required to actually join and use your information, your email and any of that. If you require CEUs for today, please feel free to put your information down in the chat box, send it to all panelists, and that way we'll be able to get you that CEU that you need. But I'll also make another reminder towards the end, just in case, but please feel free to do that right now. But I'm going to go ahead and get started with this presentation now that I think we have everything up and running. But my name is Jose Romero. I'm one of the bilingual community education facilitators here at Hope Store New Beginning Center. And today we're going to be covering a topic that I don't see covered very often when it comes to when we're talking about domestic violence, but it is a very important one. And that is the intersection that domestic abuse and substance abuse have. I have a prior history of working in facilities where we were working with individuals and clients that had a history of drug use and current addiction at the time as well. And a lot of what I had to do was work with them to help them get the resources that they needed to get themselves out of that situation and go through the recovery process. And what I've seen with in this line of work that I've been doing with bringing awareness into the community, when I started doing some of these presentations, I was also getting the same type of feedback from some of these individuals. They would tell me, well, I try to get help from some shelters, but they would deny me because they know I have a history of substance use. And that would completely cut out this individual or disqualify them from receiving those services that they did need. But there's a whole stigma behind that, but we'll talk about that. I'm going to be presenting a webinar on the stigma behind substance abuse next week on Wednesday. So that's a shameless plug for that. But the topic is very important because we know the substance abuse and domestic violence go hand in hand. So we're going to be talking about that a bit more about here as we move through the presentation. But I am part of the education department, and what we strive to do is we promote healthy relationships and empower community members of all ages to understand, prevent, and respond effectively to all forms of abuse. One of the things I hear often when I'm out or before this whole COVID-19 and when I was actually out in the community was when I mentioned our MIP program and how we work with batters to help them as well. We get a lot of feedback as, why are you also, like, it's great that you're helping the victim, but why are you also focusing on the perpetrators? They don't need that assistance. Let them figure it out on their own. But when it comes to domestic violence and stopping that cycle, if we help the victim and help the victim, yes, that's a great thing. But we need to know that if we don't address the perpetrator and know that we need to help them stop, or else they're just going to find another victim, that cycle is just going to continue. So we need to help them address it. And the same thing applies with substance abuse. Just because somebody uses substances does not make them bad, doesn't make them an evil person, and it doesn't disqualify them from actually receiving some of these services. But unfortunately, that's a lot of what these clients have been sharing with me that they do constantly get turned down when it comes to seeking those services. So our little roadmap for today and what it's going to look like, we're going to be talking about, oh, we're going to be talking about, and actually I'm going to give a disclaimer too before we actually start with this presentation, because our presentations have usually been very, very friendly for parents to have their youth watch with them. This one, the topic is just a bit harder for teens. So I am going to be covering some substance, some different forms of drugs. So if you don't feel comfortable with your youth watching that, we completely understand. But I just wanted to put that out there because, again, a lot of them have been very friendly for youth and teens, but this is going to have a lot of substance use as we progress through it. So I just want to put that out there as well. But we're going to be covering what the definition of substance abuse is and what it has to do, what that intersection is with domestic violence. I'm going to share some personal stories that I've had with different just clients I've worked with before in the past and currently in this position, and just what they've shared with me and how we can address that moving forward as a community together. We're going to also touch on some statistics when it comes to domestic violence and substance abuse. We're going to talk about reasons why both the victim and the perpetrator in these cases would want to stay in something like in a situation like that. We're going to be covering power and control wheel briefly. We're going to touch on that as well. Some red flags, early warning signs, and last but not least, there's going to be a small little evaluation at the end so you can rate if any of this information was beneficial at all. And this is actually my first time giving this presentation because I've been working and just gathering information because I've really been wanting to do a webinar like this focused around this topic, just because I know it is very important. But substance abuse and how it is defined. Substance abuse is a disease that affects a person's brain, behavior, and leads to an inability to control the use of a legal or illegal drug, medication, or substance. Now I have legal and illegal bolded and highlighted in red because you do have your legal drugs, and that is more of your alcohol, your over-the-counter cough medicines, prescribed pain meds, and prescribed the depressants as well. And then on the other hand, you have your more illegal, your what people refer to as the hard substances, which are frowned upon, and those are your heroin, your cocaine, your meth, fentanyl. So there's a difference between the two. The legal the legal drugs, when it comes to society and how we look at it, it's more acceptable. Yes, you expect to see alcohol, maybe a bit of marijuana at a party, and that's perfectly fine if you do. But if you start seeing some of these other illegal drugs, that's when it becomes a bit more this person, there's something wrong with them, they're clearly an abuser. When you have that mentality, though, if you're working with clients and you have the mentality, okay, this individual is coming to me and they have a substance use, they're abusing alcohol, I'm more reluctant to help them rather than having someone come to me and tells me, well, I'm addicted to fentanyl, I have been using it for the last 3 years. So people's mindset when it comes to that, it's okay, it's scary hearing about someone doing some of these harder drugs. They got themselves into that situation, so we're going to let them figure it out. I don't want to get involved with that. And you have members in the community that have that mindset, that are just put off by some of these substances, that they hear the much harder substances, so they're reluctant to help these individuals that are actually, that could you like all the victims, all the people that are reaching out for some of these services, they all benefit from it. But those people that are having those heavy usage drugs are the ones that are really being thrown to the side, letting them fend for themselves. And it's a hard thing to see, especially when these people are sharing their stories with you, when you do presentations in front of them and they repeatedly tell you, I've tried to get help, I've tried, but everybody just turns me away. They'll turn me away when they see that I have the track marks on my arms, when they see I have needle marks and everything, and they want nothing to do with me. So it's that constant stigma tied behind it that we see often when it comes to substance abuse. And there is a difference, because we do have substance use, and that's like your recreational, where maybe you're stressed out and you need a drink. Friday night, you just need to relax. or Saturday at a party, you're using marijuana to relax. That's what's considered substance use. And then at the same time, you have that abuse, which is what we're going to be talking about. The abuse, again, it's when you can't control, you're having those cravings for that substance and you're doing everything in your possession to get your hands back on it. So it becomes that addiction. And that's, again, one is seen as a recreational purpose, and then the other one is that dependence that we're going to discuss. But one of the things I hear often too, it's, well, substance abuse, it's its own issue. Domestic violence is its own issue. So why don't you focus on what your agency works with? And yes, I get that, but we need to realize that these situations are co-occurring. Our organization focuses mostly on helping victims of domestic violence and intimate partner violence, but we have resources, and I'll have a bunch of those linked towards the end of the presentation where we can cover on how we can use referrals, the referral system to help members of our own community and use other agencies that are out there in our community that specialize in helping victims in that aspect that maybe our organization isn't well equipped to do, but we can make connections with these other organizations and work together to accomplish the same goal of making sure victim is clean from recovery, but they're also out of an abusive relationship. So it's just the community coming together and working just together to help individuals out. But I wanted to share one story real quick with y'all about why this really sparked like this interest in me. Because when at my previous job, I was doing a lot of STI educations. I was testing people for Hep C and HIV, and I had this one client that the story really stood out when she came up to me. I don't force anyone to disclose or share any information at all. I'm just asking. I asked for the details that I needed from them before I did the test. And this young lady, she was probably in her late 20s. She sits down right across from me, and she has long sleeves on, and she asked me, "Hey, I need to get a Hep C test." So I'm like, "Okay, no problem." Like, and I ran her down through the basic information that I needed to get before I started the test. And I let her know. So this is just going to be a finger prick. I'm going to take a little blood sample from your finger and I'll get the results in about 10 to 15 minutes. And what she ends up doing is she rolls up her sleeves, and I could see that she had track marks of where she had used the needles, but I didn't make note of it or anything. I saw it, but I didn't address it. And as I'm doing the test and everything, she asked me, "So, do you like your job?" To which I replied, "Yeah, I like helping others." And she says, "I used to like my job as well." She follows that up with telling me that she used to be a nurse, and she ended up getting fired from her position because the hospital found out that she was abusing substances. And it turned into her just opening up, sharing so much information, because again, we did have those 10 to 15 minutes, and she starts telling me that her boyfriend was very abusive in their home. Every time she was done with her shifts, it was the same thing. He would put her down over something. If there was no dinner, which of course there wasn't because she was just getting home, he would be upset. He would start throwing things at her. So it got to the point where she started taking regular like medications that you see at the pharmacy. She started taking ibuprofen, Advils, and everything just to help numb a little bit of the pain. But then it started escalating. The abuse, the relationship started getting more physical, and she started feeling that pain. So she started going and getting her hands on pain medications to cut down on some of that pain. Once that pain just wouldn't stop, she would up her dosage. It got to the point where she started using heroin, cocaine, and she was using syringes to get the drug into her body system. So her use started escalating. It started just escalating. And it started from a simple, I need to cope with this. How do I get myself out of this situation? How do I forget? How do I help myself forget? And this is what she found worked for her. But slowly she started realizing that her tolerance for these substances was increasing. So she would have to increase her dosage. And this is why she was escalating the type of substance she was using. And it turned into her telling me, every time I try and get help from someone, it's always the same thing. It's always, do you have a history of drug use? Facilities that she was trying to seek help at with drug testing to make sure she was clean. If she relapsed, they would kick her out of the program. And that's something that we have to understand, that relapses do happen. Relapses happen to individuals that are suffering from substance abuse, because that domestic violence, those issues that they're putting up with from prior relationships, current relationships, you don't get rid of them overnight. It takes time to help them get themselves out of these situations. But that entire conversation that I had with her just made me realize that there is a severe lack of awareness when it comes to a topic of substance abuse and domestic violence. It's very important that we talk about it, and it's one of those uncomfortable topics that you need to have, because you're talking about drugs that you don't really, some people don't really feel comfortable talking about, but again, they are connected when it comes to substance abuse and domestic violence. Some other forms of the connections that they have is, and it's usually a tragically common pairing, because it does escalate the forms of abuse that occur when someone is under the influence. And most domestic violence incidents in some way do involve some sort of substance abuse. Oftentimes you hear, well, my partner beat me because he was drunk, he was intoxicated. And we'll we'll scratch this one out of the way, but alcohol does not cause domestic violence. And we're going to talk a little bit more about that as we progress through this. But we know that domestic violence is a choice. It's not an anger management issue, it's not an intoxication issue, and it's not a substance use issue. Being a victim of domestic violence or growing up in a family where domestic violence was present are major factors in adolescent substance abuse and adult addiction. And a lot of this, again, it's coming down to the normalization of seeing your parents doing this in a relationship. So if you see that a parent is coping with their domestic partner by using that sort of substances, these children grow up thinking, okay, my parent did that, then it's perfectly fine. It's perfectly okay for me if I do it as well. So a lot of the substance use and the domestic violence becomes normalized to children that witness it as well. Abusive, again, we've talked about this already, abusive conditions are extremely difficult to cope with, and sometimes this is what the individual needs to help them get through their day. As hard as it may be, this is probably what they turn to that helps them just relax and even them out for at least for a few hours, if anything. Substance abuse makes domestic violence more likely, and domestic violence makes substance abuse more likely. So again, hand in hand, you see these happening. Usually, when you see domestic violence, you're going to see some sort of substance abuse going on, either from the perpetrator or from the victim. Same for substance abuse. You're probably going to see domestic violence happening somewhere in there, and we're going to talk a little bit more about that as well. So, what does substance abuse and domestic violence have in common? First one of the more common things that you hear, it's a loss of control. This is an excuse that you hear for the domestic violence. It was this drug that caused me to lose control, so that's why I beat my partner. It's not me, it's the drug. So we're blaming that substance for it. Addiction and abuse tend to get worse over time. We know this. It starts escalating. It starts as a little, maybe it's a little push here and there, and it starts slowly becoming a punch here and there, shoving them, throwing down the stairs. So it's slowly escalating. And the same thing for substance abuse. It'll, like the story I shared with you with that young nurse, where she started with a regular medication that she saw at the store, and it slowly started going up and up. So we know that they both escalate when it comes to it. Continued behavior despite negative consequences as well. When it comes to domestic abuse, you see that when cops are being called, but there's no charges being pressed against them, or there's not enough proof, or there's no mandated court order set up against them, because the perpetrator or the victim doesn't want to set one up against them. But they know that there's consequences. They know that people are going to call the cops, but that doesn't stop them, because they feel that it's their right to abuse their partner. Same with substance abuse. Substance abuse, you can end up in jail for a lot of the substance use that are in one system. If you're using drugs like that, you're going to end up in jail. There's all these repercussions that come from it. But if that's a coping mechanism, it doesn't matter. It's just going to continue that behavior, even knowing that there are these consequences, and it doesn't stop it. Result in shame, guilt, and decreased self-esteem. You see that again in both aspects. You see that from a domestic violence victim that has been put through some emotional abuse, but then you also see that from a victim that has been using substance abuse, when it comes to examples of them reaching out to their family members. No, they're probably not going to want to reach out to friends and family when they have those track marks that they've been using syringes, or when they know that they've been using. How am I going to go to my family members seeking help when I'm high, or when they know I get high? It's like, how's that going to look? No, I'm going to be embarrassed of going to them. They're going to make fun of me. They're going to turn me away. So again, it chips away at someone's self-esteem. And it would, especially like when it comes to Hispanic family, and our, like, in my family rather, when there was talks about substance abuse or domestic violence, it was always like, it's taboo. We don't talk about this. So it's like swept under the rug. And it comes to, again, to that domestic violence and that substance abuse, it's, we can't talk about this. So it would just get swept away. Blaming others, cycles of escalation, and promises to change. This is all you see in both these forms of abuse. And we're gonna talk about why someone turns to substance abuse. We've touched on some of them, but here we have a few. Loss of a job, especially during current events right now going on with COVID-19, and everybody losing, not everybody, but a majority of people losing their jobs. This is one way they cope with that. They don't know what else to do. They have access to a substance, and they use that might be the way that the initial trying of a substance begins. Troubles in relationship, marriage. You're just tired of putting up with this individual, but you don't want to get a divorce. You're stuck in there because you want to stay in there with their children, and the only thing that's gonna calm you down is maybe binging on alcohol. To escape, to relax, to cope with the abuse. Again, we've covered this one right here. And peer pressure, we see this a lot more with teens, where they're being pressured by their friends to try some of these drugs, try some of these substances. As adults, you don't see a lot of that, but this is another way that someone can be introduced into it. Self-medicate is another one of the common ones that we see. And I'll share a story that happened with me. Actually, two different cases that happened with me. One was first, I was getting three of my wisdom teeth pulled out, and I remember the dentist afterwards was mentioning, "Hey, so you're going to be in a lot of pain. I want to put you in some pain meds. I want to give you this prescription right here. Just go to the pharmacy and get it done." And I can't recall exactly what pain med it was, but doing a lot of the work I had been doing, I know how addictive some of these pain medications can be. And I remember going into the facility, or going into the CVS, and I gave the pharmacist my prescription, and he was dumbfounded because I hadn't actually looked at the prescription. I just knew it was pain meds. And he's like, "You're like, who, like, you're getting this much?" And it turns out my dentist had given me a 2 month supply. So I had 30 pills of pain meds for that month. And then I had a resupply of another month. So it was 60 pills in total of this pain med. And it just hit me. This is how easy it is for me to have access to this. And I could have gone home. I could have put that bottle in my medicine cabinet, and then anyone would have had access to that. And that again opens the door to other individuals on how they get their hands on some of this medication. The second part of it was when I ended up dislocating my this was I was in my teens. I ended up dislocating my ankle playing sports and everything. And I remember I was given a bit of morphine to help with that pain. And there was I was probably 19. Yeah, I was 19 at the time. And I was being offered, I think it was fentanyl, or no, it had to be one of the stronger opiates for the painkillers. And they wanted to put me on one of these, and I refused on that one because at the time I'm thinking, okay, opioids are scary. I don't know. I don't want to become addicted to anything. So my mindset was, it can be very addictive just on one dosage of some of these higher end drugs that you're seeing pop up nowadays, especially with the opioid crisis that's going on right now. And when it comes to fentanyl, I had a when I was renewing my CPR license, I remember the trainee at the time was telling us about one of her stories that ended up happening where she responded to a situation where an individual got into a car accident. They found out he had been using drugs, and when the first responders went into the car to pull him out, one of them wasn't wearing gloves, and it turns out there was a lot of fentanyl powder spread all over the front seats and the dashboards. And this first responder simply touched it when he was pulling out the individual, but that alone was enough for this first responder to become addicted to that substance. It was full blown withdrawals afterwards, but you don't even have to be a user to say to come in contact with some of these substances. They are readily available. They can be found out there. As crazy as it sounds, like I've been out in the community, I've seen a lot of it happening. And if somebody was wanted to access this, they could, especially to help them in situations like this. So it's a very common issue that we see that's out there, and it's very dangerous as well, especially when you combine both of them, when you combine that substance use with domestic violence. Now, these statistics here, I'm going to touch a little bit on a few of them, but one of them was substance use preceded 47% of domestic assaults, but only 31% of non-domestic assaults. So right there alone, you can already see that there's an increase in domestic violence with those individuals that were under the influence of some substance abuse. 92% of men who assaulted their female partner had used substance on the same day of the assault, again, touching on that substance use. And then statistics released by the National Resource Center on Domestic Violence indicate that as many as 50% of all men who are in domestic abuse counseling are also identified as substance users. So the information we're seeing is, yes, there is a connection between the two. And again, just because you drink alcohol or use a substance does not mean you're going to be an abuser, but it does increase the likelihood of it. And that's just one thing I wanted to stress, that it's not a valid reason to say, oh, it's this substance that is causing the abuse, because it's not. When the perpetrator, so we're going to cover the two sides of the coin here. We're going to talk about what happens when the perpetrator is the one that uses the substance, and also what happens when the victim is the one that uses the substance as well. But when the perpetrator is the substance user, it makes it dangerous because they don't realize the severity of the abuse that they're inflicting on the victim. So they might be punching, and their mind isn't able to process that they're hitting them maybe just a bit too hard and causing actual damage. So it can increase the amount of damage that is inflicted to their victim. Clouds their judgments, decision making, often leading to aggressive behavior towards their victim. And this might be something as little as a small little argument that could easily have been pushed aside or forgotten about, but with this substance in their system, it just clouds their judgment, where I'm going to solve that issue here, and it was unwarranted. It was uncalled for. There was no need for it to escalate, but since that substance is in their system, that's what really pushed them over the edge. And substances, again, it's used to justify their behavior. This is the number one reason that they use to justify what they just did. Oh, I just beat you. I'm so sorry, but that's not me. That was the heroin I did last night, yada, yada, yada. And you hear that as the number one excuse. But the cycle of abuse when it comes to a perpetrator who also abuses a substance. They'll take their drug of choice, their substance of choice, they'll abuse the partner, accuse the substance, making them violent, and apologizes. And again, the whole cycle just starts all over again. And this is why I mentioned that we also need to address both sides of the coin, because if we're just focusing on the victim and just making sure they're okay, this cycle right here, if it goes unchecked, it's going to continue with another partner as well. That's why it's important when it comes to that. But why would a perpetrator stay in situations like that? Like, what do you think? Okay, this relationship isn't working. Let me get out of this situation. Let me find another relationship that might be better for me. But no, that's not the case. And a lot of it revolves over the power and control. They're getting what they want. They get to tell their victim what to do. They get to control the money in most cases if they have the victim working and they're just sitting at home. They're funneling their direct deposit straight into their bank account. So they're controlling all the money and they're taking away that financial source that the victim can use to get away, to find a new place, a new apartment. They're taking that away, and that's what they want. So they know that all of this violence that they're inflicting is working. So they're getting away when it comes to it. So that's what it comes down to when a perpetrator, what a perpetrator wants, they want that power and control over their individual. So that's the reason for them not wanting to leave that relationship themselves. Then we have when the victim is the substance abuser. And this is very dangerous because the victim is less likely to assess the type of danger they're really in when they're in their high, when they're using that substance that they're using. They don't, again, their judgment is clouded and they don't really see what type of danger is, like the severity rather of the danger that might be coming, and they're going to be downplaying it. At the same time, they're most likely more reluctant to leave in that situation because if they're currently high or they're intoxicated, there's no way they can initiate a safety plan that they might have set up for themselves. There's no way they can execute it under that state that they're currently in. So it does affect their decision making as well. But it also reduces the ability to defend themselves or children that might be in the house. Again, they might feel like they can do something about the situation, defend themselves in that situation, but in that state of mind, they won't be very capable of defending themselves, especially if the abuser tries to use the children against them or harm them to get his way. The victim will not be able to effectively defend herself or the children in that situation. But another one could be their substance use dependency can be used against them to control them. If I have a victim here that is using substances and I know that she's highly or he's highly dependent on this, I'm just going to remove that substance from the scenario and make sure that they become, that they start experiencing withdrawal symptoms. And then that's going to change the dynamics of what this is. They're going to want to do anything that I ask them to do so they can get their next dosage, their next hit. So it's one way that the abuser can use the victim's own dependency against them as well, which can be extremely dangerous. And with the way you see the cycle here is you see them become abused by a partner. They have their own reason for staying, not seeking help. It might be the children. They don't want to lose their children. And they start using a substance as a coping mechanism to help them get through the day, get through a few hours, if even. But then the incident is forgotten the moment the perpetrator apologizes, and that cycle again, it continues, it keeps going. It's an endless cycle that keeps going, especially when it isn't addressed. Why does the victim stay? We have numerous reasons why they wouldn't stay. Fear. I'm afraid of leaving because if I go to the cops, I'm most likely either going to be arrested because I'm using substances. So why on earth would I go out there and put myself in that situation? I'm afraid to leave because my partner can call CPS and they're going to remove my children. They're not going to believe me because I am the substance user in this scenario. So it's different reasons why an individual who uses substances would want to, or rather would have to stay in that current relationship. And again, we have no family support. We have financial concerns when the perpetrator is the one that's funneling the money into their account, religious reasons, disabilities, lack of resources. And I have quite a bit when it comes to resources that we're going to cover here shortly. But we also have substance abuse, domestic violence, and pregnancy. Now it just keeps getting worse and worse when you keep piling on different situations. And when it comes to pregnancy, individuals believe that, or some individuals believe that if we have a kid together, it's going to suddenly make things better. And that's usually not the case. If anything, it'll make situations worse because the perpetrator is losing the power and control over the victim, because the victim's focus is now the child. It's like the child is number one now. So the moment they realize that they're losing that power and control, they're going to try and do anything to regain it again. When mothers turn to substance use during pregnancy, that can affect the child, and I have some listed here, especially the fetal injuries, birth defects, low birth weight, a miscarriage, and also the increase of SIDS, which is a sudden infant death syndrome. So substance use, when mixed in with the domestic violence and even pregnancy now, it just escalate things and makes things much worse in all dynamics of the family when it comes to the abuse, when it comes to pregnancy. So it just makes the situations a lot harder than they really need to be. I'm going to talk about some of the physical abuse or some of the other different abuse and what they might look like in a relationship that would implement, or not implement, but rather in a relationship that also has substance use in it. Physical abuse, you could see that with the withdrawals, when the perpetrator takes away that drug and causes and forces those withdrawals on the individual by keeping away that substance that they're highly dependent on. Emotional abuse, you can see that by making fun of them. It's like, what are you gonna do? You're gonna call the cops? You're gonna call the cops junkie, crackhead, and they use those terms to really hit them while they're down, really, because using terms like that is really frowned upon. And again, in the next webinar next week, I will cover terms such as the junkie and crackheads and proper ways that we do address terms like that. Then you have sexual abuse, and what we see in this form for sexual abuse is forcing their partner to exchange sexual activity in exchange for drugs. Maybe they don't have money at the time. This is the only way the perpetrator is going to get his hands on the substance abuse. Okay, well, he or she forces their partner to be intimate in exchange for other substances as well. We have verbal abuse, again, using those derogative terms like junkie, crackhead, just to chip away at someone's self-esteem, to make sure they don't go anywhere, because who's going to believe someone that is highly addicted to different substances. You have financial abuse as well, and this can also be seen. One of the harder, the rougher ways that you see this is when the perpetrator himself or herself is actually supplying the substance, or is the dealer and is supplying them to their own victim. So maybe he or she's gonna start charging them more for these substances, and when the victim can't pay or doesn't have the money to pay for that, they're gonna ask for favors instead. It's like, okay, well, you can pay for this in sexual favors. And again, going back to that sexual abuse, using that substance to really abuse their partner in different forms. And you have digital abuse as well. And you see that when these abusers will record their perpetrator or their victim using these substances, and use that as emotional and blackmail them in that situations to keep them in those relationships. So these are just some of the ways that you see those forms of abuse affecting individuals who do have a substance use dependency, or if the perpetrator themselves is the one that has their hands when it comes to the connection of substances.